Hello, everyone, and welcome to another episode of Beyond the Finish Line, Navigating the Journey After Residency. And today I have another fascinating guest, someone that I've gotten to know just recently and to learn more and more about his unusual path after residency. Now, with me is Dr. Zhen Chan. Dr. Zhen Chan is a general pediatrician, and he just finished his training not too long ago in 2023. And he also has his MBA, which he picked up in medical school while he was learning everything else there is to know about becoming a doctor. And in addition to being a general pediatrician and working clinically, Zen co-founded GrapeVyne, which is a platform that connects healthcare organizations with top physicians through peer referrals. So it's kind of a placement agency that is peer-driven for physicians to find positions and also for employers to find physicians, which is a great service in today's environment. So welcome. Thank you so much for being here, Zen.
Dr. Sherman, thank you so much for having me, and thank you for that incredible intro too. It's good to see you again.
Wow, we're going to learn more and more about you as the time goes on. So I had an opportunity to meet Zen and learn more about Grapevine and learn more about his other endeavors. But he has taken a little bit of an alternative path than most folks do as they've come out of training. So Zen, why don't you tell us a little bit about your journey and how you ended up where you are today?
Sure thing. So going really all the way back, if this is relevant, I'm a immigrant to the country. I was born in Shanghai, China, moved with my mother to Miami, Florida, studied Miami, Florida when I was one, and grew up there. 26 years of my life, did all of my education at the University of Miami. So that was undergraduate, medical school, and like you mentioned earlier, I took a year off between third and fourth year for an MBA, which the Miller School of Medicine partnered with the Miami Business School to have that dual degree opportunity in just 1 year full time. And what really interested me about that at the time was it was focused on health management and policy. And I saw chairs of departments, attendings I was talking to going back, balancing a full-time schedule and family obligations and everything, going back to get certifications and these extra degrees because they wanted to get into healthcare leadership and some of these non-clinical administrative roles as well to complement their clinical work. And I've had an inkling that that's what I wanted in my career path. So I said, why not nip this in the bud and do this right now? So took that opportunity, went on to residency in New York at New York Presbyterian with Weill Cornell. That was in pediatrics for 3 years and had just an awesome time there. Met some of the just best co-residents that I could have asked for, and really had a wonderful experience. I intended to go into hematology oncology, PT-Monc, as the fellowship option. I really was passionate about that patient group, working with those families that are dealing with sort of those really, really hard times. But as I got really deep into quality improvement work and advocacy work, I felt like I was using a lot of the skills and knowledge I gained from the MBA year more than anything else clinically. And I really enjoyed that. I felt like the projects I was working on had a broader impact. So and in the venture and startup world, we call that scalable impact. And that made me kind of say, do a little soul searching, Zen, and try to talk to people who are doing other things in healthcare. So I asked one of our program directors, do you know anyone that's in the, I've only known consulting at that time. I was like, do you know anyone in the consulting world has done something a little bit alternative? And she introduced me to somebody, spoke with them. Then I asked for a connection. And every single time I met another person, I asked for a new connection to just learn, like, what are people doing in pharma, med tech, the public side, CDC, WHO, like early stage startups versus, late big companies. Like, what is everyone doing? And I got fascinated by the venture capital space and early stage company growth. And I actually, on a whim, just emailed a general partner of a pediatric healthcare innovation focused venture capital company. And they responded within like 48 hours, had some great conversations. Love that they were taking kind of the pediatric focus, which a lot of the investor community, it's still focusing on pediatrics is still not the biggest item on their
Hmm.
minds. So I wanted to like kind of be in there, learn what it was like, and also provide my pediatrics relevant experience. So I did that for about a year, learned a lot, met a lot of founders who were just so mission driven about solving problems and taking the risk to develop a business around solving that problem. And I was like, I want to be on that side. I want to be on that side of things. And also, if I'm going to be an investor, there's an aspect of needing to be a strategic investor and be able to give advice that I did not feel well equipped to give. I could talk about what are things I think doctors would use, what things can actually impact patients, but how to grow a company, the MBA doesn't really, it gives me the vocab, but it didn't really give me boots on the ground experience to do that. So I was like, I want to just be on the operator side, both from a personal, like I want to grow something, but also from a, if I ever want to do investor side things again, if I ever want to advise or consult for others to help them, I need that personal experience as well. So that's kind of what led me to building GrapeVyne. I saw a lot of pain points and struggles, frustrations, whatever you want to call it, for doctors in the job search process. Lack of transparency in job description, lack of trust in the people that are often you're talking to, like recruiting companies. There are a lot of frustrations there. And then employers are spending a ton of money on on an admin expense in order to use methods that are very ineffective. So there's a cost savings, there's a problem on the other side. And I was like, that means there's a business solution in the middle. And very luckily, I got to meet the managing partner of a venture studio here in DC where I am. His name's Mike Batista. He's the managing partner of HealthWorks Studio. He was very passionate about this concept as well. He had a team kind of already doing some of the research on this concept. And I was like, hey, I would love to be a founder of this company. And he brought me on, and that's been the last year. So I practice full time. I work full time on GrapeVyne, and I practice per diem in a fast track emergency room setting. So about one shift a week.
Wow. All right. So I said this is a non-conventional pathway for a physician. But I heard a statistic recently which really shocked me,
Mm-hmm.
and that was that um, something like 50% of current medical students, residents, let me combine or something, are
Yeah.
really considering or planning on going into something other than direct patient care, of doing something that is either in pharmaceutical industry, biotech, some type of biomedical instrumentation, something else other than that. And I think it has to do a lot with kind of the increased I don't know. I think corporatization of healthcare and the as you go into clinical medicine, more and more trainees, residents, medical students are reading about burnout, about how hard it
Mm-hmm.
is to kind of like move into those areas. So I'm curious, as you went through medical school, obviously you had a bent toward business. You were already thinking that. You added on the MBA in the middle of medical school. Many students that I know kind of do MD PhDs because they're trying to figure out, do I want to do research, academics? But you added on the business component. As you were going through all of that and then going into residency, when did it hit you that, I'm probably not just going to go out and do a fellowship or get a job or be employed as a full-time clinician?
That's a great question. I in undergrad, high school, yeah, I think high school was when I started to be very extracurricularly involved, and I really enjoyed having those leadership positions, working with groups and having conversations. I was started to become more and more extroverted, in high school and in undergrad. And I think when it hit me was like, I didn't go into medical school thinking I was going to do anything beyond clinical practice. So when it truly hit me was when I was having those conversations with attendings and chairs of departments, people in those leadership roles already, and seeing that, well, I had an inkling that I wanted to do those leadership type of roles also as well, but focus mainly on the healthcare administration side or hospital administration. That's kind of the only way I thought I would like do something non-clinical in the future. And that's what got me into the MBA. Once I got into the MBA, that's when I think things started clicking a little bit, or I would call it the seeds of these thoughts, because healthcare economics and healthcare policy ended up being some of my favorite courses in those 5 years of medical school and business school. And I saw that, we learned one concept that was about like opt-in versus opt-out programs. And in the US, organ donation is an opt-in program, right? Whereas in some other countries, it's an opt-out program. And that means people are default organ donors, whereas here people on default are not organ donors. And how that sort of change actually makes the percentage of individuals in the population willing to be or with an organ donation status drastically different. And those types of learnings, the concept of a nudge in behavioral economics, like those types of learnings really made an impact on me to say, oh, healthcare or clinical medicine is only one piece of a person's health. And on the healthcare policy class, we learned 80% of a person's health is more to do with social determinants as opposed to a person's interaction with their doctor or any kind of clinical care. And that's the seed of starting to see, oh, clinical practice, a lot of it has to do with treating people when they're sick. And I started to wonder, how do I prevent people from getting sick? And of course, there's primary care, prevention medicine, all that kind of stuff. Wonderful stuff. And then I got into residency, and I think that's when it really, really solidified that mentality, that mindset, because our inpatient medicine, the hospital door is like a revolving door. You discharge one person, the next person comes in. Sometimes you discharge someone and the same person comes in multiple times. In primary care practice, I often felt like I was pressured to check boxes more than I was to provide the adequate care, right? Like we had a 20-minute visit, or as residents, we had the perk of having 40-minute visits for primary care annual checks. But once I have an adolescent in front of me who has mental health concerns and also obesity concerns or other chronic disease concerns, and you just have two acute matters that you need to take care of, 40 minutes is not enough time. Like, and I just felt very pressured to do something, and to that wasn't what I was intending to do when I went to medical school and everything. And I think that's when it started clicking that there was something more to work on in the broader scheme. So yeah, I hope that answers the question.
Yeah, it
A
sounds
little
like
bit.
you definitely come in with a big picture view of things.
Yeah.
It's almost like while your classmates were memorizing the Krebs cycle or just trying to figure out what their attendings wanted them to be doing, and
Uh-huh.
and whether they had their notes written and everything, you had this kind of 10,000-foot view of things, and took a step back and had uh, that presence of mind. And I think
Uh-huh.
most trainees, I feel like most trainees are so busy just trying to keep up, just trying to kind of get to the next, milepost, the next finish line,
Uh-huh.
that to have that broader view is much more challenging. And I'm curious, as you interacted with your classmates, your fellow residents, what were they viewing of you? What did they think of you
Yeah.
as you were doing all this stuff?
That's a great question. I think everybody was definitely had an intrigued mindset. Was like, oh, Zen definitely is like someone that's going to do something a little bit different, off the beaten path. Um, I I don't think I ever asked anyone specifically that question, to like ask them what they thought of things, but definitely people were interested. Definitely people, I think, saw me as having different passions in our careers. And I think having that, like, I just really want to be really good at this one thing. Like, I'm going to specialize and super specialize in like whatever it is. I think that's very necessary too. We need experts in the field. And trust me, I often feel like that imposter syndrome where I feel like I'm an expert at nothing. Like the jack of all trades, master of none mentality. I definitely get that a lot. And in medical school and residency, right? Like when I chose to do the MBA, I definitely had is this going to be a distraction? When I was in residency and thinking I wanted to do something broad and choosing not to go into HEMONC fellowship, is that going to be continuing to make me a generalist as opposed to a specialist? But a generalist, even beyond just developing pure clinical medicine, it was like, am I going to be just distracting myself with too many things? And I'm still answering that question, to be honest. I still on a day-to-day basis question the decision to do what I'm doing. And I think that's okay. I think everybody has that internal dialogue. And I think that internal dialogue's okay, and we're all kind of just working through it.
Yeah, and I think that's a big difference. I think increasingly that as folks are coming out of medical school, out of residency, it's not like, oh, yeah, let me find the job that I'm going to have for the rest of my life. Let me find that job. I'm going to settle down in my hometown and be the family doc for, forever and
Yeah.
retire from there. It's kind of like the philosophy of knowing that this is my first job and then there'll be another job and then another job. And I
Hmm.
think that's kind of a generational change that I've seen over the
Hmm.
years. Um, and so I wonder as you go along, you finished residency in 2023 and you've already had a few jobs, it seems like, in different areas. Is that right?
Yeah.
Yeah.
Well, the venture capital position, that was more of it was a fellowship essentially, right? It was to learn, it was to learn about how to build a fund, how to due diligence on these companies that we were looking at and evaluating, and then providing my clinical background as expertise to the area. But it was a part-time fellowship. So I was definitely picking up a lot more shifts at that time to practice clinically. But once I decided I wanted to be on the operator side and build something on my own, that's when things kind of flipped and it became a full-time new job.
Got it. Got it. All
Yeah.
right, let's switch to GrapeVyne, your baby. Let's
Yeah.
hear about it. Tell me about how it works. What are the nuts and bolts of it? If I were a physician and I'm kind of sitting here wondering, okay, I got my first job. Like for me, I got my first job in private practice pediatrics and realized very quickly, even maybe before I started, that this was not the job for me. So I'm wondering what I should be doing.
Sure.
So how does Grapevine fit into all that?
Yeah. So, well, firstly, the name itself
Yeah,
comes from heard it through the grapevine, great song, right? And so
way
that
before your time.
still a classic, still a classic, still got to listen to it. And that is the core of what we are. It's trusted, established connections sharing together, right? The peer-to-peer piece. So right now, with how physicians look for jobs, usually the kind of top three options is number one, use your network. Who do you know? The program directors, can they help you out? Your former colleagues, can they help you out? Maybe you know someone at the institution you want to go to. Can they help you out and give you more info? Direct networking is going to be the best bang for your buck to find a new job and learn about it and get accurate information. Let's say you've exhausted that, and the next piece is, all right, well, I'm going to Google jobs, pediatrics in Washington, D.C. What is out there? The problem with that is a lot of job posts just don't do a great job of focusing on what doctors value and what doctors need to see or want to see to engage with the post. And this is not something that's exclusively an issue for physicians. It's an issue a lot of industries, like the employee side, are facing. And um, that's one piece that we want to change, right? We are designing our job posts to be as detailed with what is valued, staffing ratios, EHR, the department size, what your on-call responsibilities and schedules are going to be. And then upfront, like, I mean, one of the most basic two things, salary and location. Oftentimes you don't even see that. It's like, hey, we have a competitive salary and a beautiful location 4 hours away from the beach of Virginia. And they're like, I don't know anything about this job. I would apply to it. There's also these ghost jobs that are posted, which are just for employers to sort of fill a stack of resumes or CVs or names so that they don't have a job now, but in the future, when they do, they just have these people to reach out to. It feels a little bit predatory, right? Like on the physician side, because you're thinking this is a real job and you're applying to it only for it to not really even be a position that exists. So job boards have a lot of these frustrating pieces.
Let me
Let's say
ask you
you've
just a
exhausted.
question about that,
Yeah.
about this kind of ghost job thing. So, are you talking about big hospital corporations that perhaps, they're trying to recruit a pool of applicants or potential folks to fit different jobs that they're not sure about yet?
So it could be the big corporations. It could be smaller groups too. Groups that
Hmm.
are groups that have the budget and are
Yeah.
willing to spend so that they can fill their talent pool, so to speak.
Wow. Okay.
So they do exist. Yeah, and that's something that just it's not. It doesn't really affect the searching and clicking process for the physician, but it definitely doesn't feel great when you as a doctor see this job, you're actually interested in it, you click apply, you submit all your stuff, you spent 30 minutes, maybe an hour, only for that job description to not have actually been a job.
Yeah.
That's not great, right?
Yeah.
Yeah, so that's kind of the ghost job frustration.
Okay. All right.
Um,
So
and
now
then
I'm a physician and
mhm.
how do I use your services? How does that work?
Yeah. Well, so you as a doctor, it's free to sign up. We use a kind of two-step verification with your cell phone number, sign up for an account. Your NPI is all on the NPPS registry, so we actually can just automatically create your account. You just provide your NPI, and then we can put your name, your location, and everything. And then there's a user profile creation process, so that we get a little bit, we learn about you a little bit more. Your profile is all private. No one's looking at it. No outside recruiters are accessing this platform. This is physician exclusive only at this point. Um, Now you're on GrapeVyne. You have a dashboard and you can see jobs. These jobs, like I said, are very transparently laid out. We even include things like average home values and neighborhood scores and public school system data. We integrate all that into the job post. You see them, and if you want to directly apply, you can. There's no reason why you can't. But the idea is if you see a job and you actually feel someone you know could be a good fit or someone you know is looking and this is something that they could be interested in, you could easily refer that. There's a little button that just says refer, send that over, and then the rewards start to kick in. So if they apply to the job and it's a qualified application. Like we don't want any OBGYNs applying to cardiology jobs and things like that. But if it's a qualified application, you as the person who referred them will get a small reward, cash reward at that time. If they complete all the interviews, you get another incremental incentive. And then if they actually start the job, get hired to start the job, that's like kind of the big payout. And we lay this all out on every job post transparently, exactly how much at each stage will be. So there's nothing that's like opaque or obscure about it. So that's what GrapeVyne is today. But ultimately, what we want to build, our long-term vision, is a community that we will automatically or facilitate the ability for physicians to network with each other, to access resources, whether that's education, CME, or a healthcare lawyer to help them with contract negotiation, or a physician coach because they want to kind of have that professional development, gain more skills. We want to be able to facilitate those connections for you just based on your user profile and expression of interest in it. Physicians are very busy. We know we should be networking, but often are too busy, maybe a little bit too shy or too scared to reach out to others. And we just didn't go to business school where networking
Yeah.
was a lot more emphasized. So this kind of feature of this community is a way for us to say, you don't need to do any legwork other than creating your user profile, express interest in wanting to meet people, and let's curate those connections for you and curate educational materials for you. And then have spaces that you can talk about, like, I don't know, like, let's say you're just all physicians who love to fish. Let's put a little space for that, and you can commiserate on it. You have non-clinical interests in doing in being CMOs of tech companies, or you want to get into real estate investing. Let's get you the other resources, because there's a lot of clinician-led groups that are already focusing on these spaces. Let's connect you with them. Let's get you into those groups as well, so you don't have to actively be searching for them, and spending the few hours you have left after work and family to think about more work.
Wow. So this platform is more than just kind of an employment match
Mm-hmm.
platform. This is going to be an expansive kind of physician community interactive platform eventually, sounds like.
That's exactly what we want it to be, and we feel like it's not even a secret sauce. It's just what we are: a physician-led, physician-driven, and hopefully, crossing our fingers, physician-invested
Hmm.
a company as well. So like everything is just we are a community of people that understand each other. Like the people that are leading this, the people that are invested in this, are all our colleagues.
Yeah, I think today, in today's world, isolation and loneliness is one of the primary challenges for physicians in
Mm-hmm.
practice. And I think we come out of medical school and residency where we're always with a group, where we have our cohort, our residency group, our people all the time. And then all of a sudden we're out there on our own. And especially since COVID, a post-COVID world, people are feeling much more isolated, much more siloed. So something like a platform here not only provides more transparency with what jobs are available, but also sounds like it's providing a community for people to feel supported. And also, I love this idea of, oh yeah, my friend is looking for a job in this. What about them?
Mm-hmm.
Yeah, I love that idea.
Yeah, I two points. One is a anecdotal story I'd like to talk about. Is just this past weekend, I was at the American Academy of Pediatrics Advocacy Conference. Luckily, I'm here in DC, so it was very convenient to go to. And I met someone who was having challenges with their current situation, their current practice, and they were looking for something new and just having a tough time. And I said, "Oh, actually, I'm a founder of GrapeVyne, and this is what we're doing." I don't know if like they're from southeastern region of the U.S., and I was like, "I don't know if we have any great jobs for you, but this is the concept. Would love your support to sign up." And they did, and they applied for a job. They found a job and applied literally like 48 hours later. And they said, and when we process the application and we submit everything over to the employer, and so I got to take a look at the CV, and I was like, oh my God, this person is like kind of perfect for this job. Like in terms of their mission driven aspect, what they were passionate about. And this was like an Indian health focused clinic. And so like this person had experience in that, wanted to go to a different place, was previously licensed in the state of the job that they applied to. And I was like, man, this is perfect. And I asked the question, like, hey, I'm curious, did you find this job posted anywhere else? Had you heard about stuff like this? And they're like, no, I've been looking and I didn't find this anywhere else. And so it's just kind of a testament that says some of these hard to find jobs can be delivered with more, can get more engagement and visibility through the grapevine, right?
Yeah.
So that was an awesome story just from this past weekend. And the other, well, I
Do you
actually I
get
got so
points for
excited.
that because you were the one that referred that client to Grapevine? And you got,
Yeah. Well, so, for me, it's just brownie points since I'm running it.
oh, okay,
But
all right,
but if this was like, let's say, Joe, you knew this person and
yeah,
you were the one to share that over, the incentives would go to you.
yeah,
And you would kind of make that, right? And it's also that's part of the kind of keeping money within the physician community piece. There's so many intermediaries now in healthcare that is honestly just wasted spend. And so if we can cut out intermediaries effectively, that's another sort of win for us.
mm,
And oh yeah, the other point I wanted to make was to your point about craving community and relieving isolation. I think part of that is, maybe this is a theory of mine, is that because medicine has become so corporatized and physicians are more just employees of employers, there is a sense of like, this is a job, and it's my 9 to 5, or it's my 12-hour shift, or whatever it is, and then I go home, and it's not us together building a practice. It's not us together doing something, like kind of building something from the ground up. Um, and these corporations may not really often have the best interest of their physicians or their workforce generally in mind. There are groups out there that have great programs to support their workforce. For example, I think of like the Mayo Clinic. They have this Compass program. It's under their like program for physician well-being, and they create support groups for doctors to get together and all these kinds of things. That's awesome. I think we should find more of that, and I think GrapeVyne can deliver a digital version of that, especially for early career physicians. And so I think part of the reason why there is so much isolation and lack of community is maybe because of this trend towards corporatized medicine.
Yeah, I think so too. I think also just I think back at my experiences clinically and the jobs that I have had over the years, and the amount of interaction that I have had with my colleagues was a lot more. It was just in the office itself. We would talk to each other in the hallways, back in the physician room, in our offices, kind of constantly asking each other, come take a look at this rash. What do you think about this? What do you think about that? Um, we didn't have computers or all these other things that are around today. Also, in hospitals, if you went to the nursery making rounds or something, there would often be the doctor's lounge. You drop by
Yeah.
there, say hello to people. You would see people on rounds. So there were all kinds of other venues that were possible.
Yeah.
But today's physician, especially new physicians, they're used to virtual connections and and making and finding community that way. So
Yeah.
this is a great way to do that. I'm curious about what type of access do the employers have to the physicians who are registered on the
Mhm.
platform?
We want to deliver a very private, secure experience for the physicians. So right now, there is actually no access to anybody, no access from outside parties. Now, we think that there is a way to still maintain that security and privacy and provide dashboards, right? Like, it's a software feature to provide dashboards for the employers in order just to see, hey, automatically, like, how many applications have come in, how many clicks and views and things like that are on our jobs. But still, our goal is to not sell out the physician. Our goal
Mm-hmm.
is not to give your contact info to anybody. There are groups out there who, they monetize through mainly ads revenue, and that could be from pharma companies and huge medical device companies and things like that. I That just doesn't sit well with most
Mm-hmm.
doctors, right? There's another group that, there was a lawsuit because the physicians who signed up found out that their conversations, which were anonymous, about what drug to use or what device they were preferring, those conversations were being sold to companies. Um, and I mean, you did sign the terms and conditions. That's kind of the argument, right? Like, oh, well, you signed the terms and you
Yeah.
you signed up for this platform. But that whole entire bait and switch mentality, like, that's why I think having a clinician run company like this is so important, because we all get it. We all will focus still on the mission and the values.
Okay.
So yeah, that's so to answer your question in a long way, no visibility right now from
Okay.
outside.
All right. Okay. And where are you along this line of development now? At
Hmm.
what point are you now, as far as, say, and I imagine well, I don't know, as a physician, kind of accessing your platform, is there a fee that you pay in order to be a member of this?
No, not at all. Completely free.
Really?
Yeah,
Wow.
completely free to access. Right now we are, and from a development standpoint, the job marketplace is our focus. Our next step right now, we're doing some kind of feedback testing to see, like, what how many people will want to use this connector feature to network with each other. What are individuals going to be willing to answer for us in order for us to provide valuable connections for you, and all these kinds of things. So we're in the testing phase, and we want to try to build that as our next step. We've contracted with 8 healthcare organizations across 10 states. Right now, actively listed, we have 68 jobs on the platform across a whole variety of specialties. And then we've gotten, I think the latest number today was we are at 587 doctors signed up for the platform.
Wow.
And that's only since, back in September of last year. So only about 5 months ago, we were at about 110 physicians signed up. So that growth from 110 to over 575 has been pretty rapid. The message is really resonating with doctors.
Yeah. How are you getting the word out? How are you getting
Yeah.
the word out about the platform and everything else? Yeah.
Mm-hmm. Well, doing a lot of talks just like
Yes.
this one. Yeah. Having great conversations just like this one to be able to kind of thoroughly and in detail explain. But we've also been doing a lot of Instagram, some Instagram ads, not a lot, working with great, social media physician influencers that are out there that people follow. We are on LinkedIn. There's a whole sort of content strategy on LinkedIn, TikTok, and Instagram. There's a whole content strategy that's coming out of my personal account. And the content strategy, right? Like we in marketing, this individual we worked with, she was great. She was like, you want to make it like 80-20. 80% of your content should not be selling anything. It should just be what's valuable to your users. And I was like, I love that. That's just what I want to do anyways, right? Telling you about what you should be doing in your job search, how to find healthcare lawyers that are going to be helpful for you, find salary compensation data. I love doing that. 80% of the content strategy is there. And then 20% is selling. So just a little bit of advertisement for like what GrapeVyne is and things like that. So you could find me on social media. And I'm trying to build that up a little bit.
Okay. And I mean, this sounds great. I mean, there's nothing to lose. It doesn't cost you any money if you just want to see what's out there and get information about the job market.
Mm-hmm.
And it sounds like it's growing and growing and growing. And it certainly does cut down, I would imagine, on the costs for hospital institutions, healthcare organizations to hire recruiting companies, all the rest of the stuff. That this is a shortcut for them too.
Yeah.
And even private practices and groups, it's sounds like
Yeah.
it's a win-win situation.
We're able to price very competitively because we are not dependent on a recruiter commission sort of, operation. So our costs are definitely lower. Essentially, our cost is just to operate the company, and then to pay out the incentives to our users. So there's a little bit of, honestly, there's like a little bit of buy-in there with our users to align the value for everybody. So yeah, our pricing is very competitive on the employer side.
Okay. So how are our listeners and physicians going to be able to sign up for Grapevine?
Yeah. So the website is grapevine.health. Now, it's grapevine spelled with a Y, not an I. So grapevine.health is where you can go to check out what we're all about. We have a career hub. We call it our kind of phase 1 of the career hub. That's to get you some resources that honestly I've found helpful personally for my own journey. And then I've delivered onto the career hub. So for job searching, for understanding practice management and healthcare finance, great doc on that's like big on LinkedIn. Dr. Eric Bricker. He's a family medicine doc who has all these YouTube videos for free about healthcare finance. And I think they're amazing. They're just like whiteboard videos, 10 minutes, 15 minutes each. So we have that hosted on our website. A couple physician coaches that we've now worked with that are hosted there as well. Communities to join that are outside of GrapeVyne that can help you understand, concepts like value-based care versus fee-for-service, what everything in healthcare beyond clinical practice is. There's a group called MD Plus for all medical students that are interested in more than clinical practice. There's all these little resources that we have there. And then you can log into GrapeVyne just through our website. You sign up for an account. You can also find us on Instagram. We're at grapevine.health as well, at grapevine.health with the same letter Y spelling. We're on TikTok, grapevine _. So you can find us all over these places and sign up. Like I said, it's free. Just need your cell phone number for the verification and your NPI just to make sure you're a clinician.
Got it. All right, I'm signing up. Gonna do it right after
Thank you so
this
much. Yeah.
recording so I can start looking for jobs and start referring everybody.
Yeah. Yeah. Yeah.
Gather up my points. So I want to ask you a couple of questions getting back to your personal story.
Mhm.
And so say that I'm a medical student or resident, and I've been inspired a lot by Zhen Chan telling me all about these things, and I have this kind of big picture mentality and viewpoint. Do you have any advice to folks that are in that situation about kind of how to move forward in their careers?
hmm Honestly, and I mean, I'll put myself out as a resource. Anybody
Okay.
who's interested in connecting, I'm more than happy to have some conversations about to talk through your interests. So you can reach out to me. And beyond that, I would say the number one way is to talk to those attendings, those leaders that you're already associated with. If you meet someone who's in a position like you learn that they're a CMO of a tech company when you're rounding with them, or they have a leadership position in the hospital that you're training at, like ask them those questions about how they got there, what motivated them to do that. Um, and that's going to be like your best bet, just direct network and do what I did which is once you have a conversation with one person, ask if they know others that can potentially be of help to you too as you're thinking about all these things. Now, one of the challenges is um still well, it's definitely gotten a lot more open, but one of the challenges I had was when I asked these questions like in residency, there were some attendings who were like just hesitant to even provide any network for my interest because they're like, oh, that's just going to distract you from clinical medicine, and things like that. There's still a little bit of, I think, that old school mentality about it.
Mm-hmm.
So you just have to be a little bit careful. But if you see that they have these positions and are working with other groups, I met again at this advocacy conference a physician, a pediatrician who now does like clinical trial work with a consulting firm. So like, that's immediately just something you should be asking about. And they're probably interested in telling you. So direct network is definitely your first best bet. Um, then let's say you've done some of that work and you're starting to hit a wall. I would say the next thing is create a LinkedIn profile, look up people who are in the positions of the industries that you're interested in. I got to give a plug to the MD Plus group. Again, that med students, residents, attendings who all are either in an additional, that's the plus part, an additional job or opportunity, or people that are interested in joining or learning more about it. And it's a great group. I know the founders. I'm happy to connect anyone with them, with their leadership as well. So that's another great one. And then learning from some of the newsletters and resources out there. I mentioned Dr. Eric Bricker earlier. If you come to the Career Hub on GrapeVyne, we have a section called communities, healthcare communities. And there's a couple others that we feature. Like one is called Out of Pocket healthcare. One is called Healthcare Huddle. Healthcare Huddle is started by a gentleman who's PGY3 internal medicine in New York, and writes about just from a physician's perspective all the inefficiencies in healthcare and things like that. And these are the types of people and communities you want to join to build your network.
Yeah.
Um, yeah, I don't know how many times I've said the word network in
I
this
know, I was going to
this
say there's a lot
conversation.
of networking going on. Yeah,
Yeah,
and that has to be challenging because I know that for me, when I was going through med school and residency, it's a lot of intimidation. These folks that are attendings and big shots. It's you have to have courage to approach them
100%.
and to feel safe in doing that. And like you say, I think that's important to be selective and know kind of like who's approachable, who's not. Uh,
Yeah.
but in general, people who feel like they're important love talking about themselves. So you're right. Yes, they love
Yeah.
to talk
No.
about themselves all the time.
Yeah. I was just gonna say one very specific actionable, I think advice I
Yeah,
would give is if you have someone who you're working with on the attending level, or maybe a resident or fellow who is doing something in clinical informatics, I have had really good luck in having conversations with them because they are interested in that topic. They are passionate about that topic, And those roles, those clinicians who are in informatics are working with other hospital leaders and involved in the operations side. So if you find anyone there, take advantage of that opportunity and reach out to them.
Got it. Wonderful. All right, Zen. So how can people get in touch with you if they wanted to learn more about your journey and about GrapeVyne?
For sure. My email address is zen, at grapevine.health. Again, I always have to say grapevine with a Y. And then my Instagram is at zen_MD. So you could find me there and direct message me. I'm on TikTok. You can find me there. LinkedIn is one that I'm pretty active on. So ZenMD, ZhenMD, straight up, is my profile. You could also look up my name. And those would probably be the best avenues. Facebook, I don't use too much. So if you message me through Facebook, it may take me a while to
For us old
respond.
people, yeah, you don't mess with that. Great. All right. Last question. And that is, if you were not this amazing entrepreneur, startup, business genius / pediatrician, what would you be? What other profession do you think you would be if you had chosen a different path?
Man, oh man. Yeah, I feel like the path I'm in is already the answer to the question of what would you do if you were choosing a different path. But I grew up really liking to cook. I would stand next to my mom when at the stove from a very young age. One of my first play sets was just plastic food. And I would pretend to chop them up and everything. I still love to cook now. If I had to pick a different profession, it'd probably be to be a chef. And now taking on opening up a business that is a restaurant and bar, maybe cafe during the day, have books in it so people can just hang out, make it a workspace, host different chefs that need a space to have a pop-up. I'd probably do something like that and then be able to cook in there myself. Yeah, I could talk about this for another hour if you have time, but that would probably be, chef / restaurant owner.
Got it. And knowing you, that a couple of years, there's going to be your restaurant along with GrapeVyne and other endeavors that you're involved in. So,
yeah, back in Miami, I met I didn't meet them, but there was a Chinese restaurant that we went to that I found out was owned by an anesthesiologist. And he worked, I think his clinical shifts were just 2 a week. And the rest of the time he was a chef at his restaurant.
In the kitchen. Sure. Of course. Of course. Wow, Zen, thank you so much for taking the time to chat with us and tell us all about GrapeVyne and all about kind of being an entrepreneur as you're a doctor and a pediatrician, of course. So it's the best kind of doctor. But anyway, thanks so much for being with us. Thanks for taking the time and sharing all of your wisdom during this episode.
Absolutely. Thank you so much. And if I could just give one more plug to something that you mentioned earlier, for all the medical students and pre-meds who are interested in things outside of clinical practice, I know that sometimes what you read online and what you hear from attendings can be a little bit discouraging in terms of that's what you're interested in. But that's your life passion. That's your career. If that's what you're interested in, don't be discouraged by, the antithetical messaging or whatnot you want to call it. There are many ways to help people. Just make sure that is the core value, that you're going into medical school, regardless if it's to get into tech or whatever, or clinical practice, that your core goal for that is still that you're trying to help people. And the patients are the downstream impact of everything that you're doing. So yeah, just wanted to share that message.
Thank you for that message. Always follow the authentic voice inside of you. That's the one that is really telling you who you are. So thanks so much, Zen. It was great having you with us, and hope to continue this conversation in the future.
Thank you, Joe. Glad to be back.